Hello, everyone. Today I'm here with Dr. Ashley, and she's a naturopathic doctor in San Diego who was originally from New York. And I loved her story. I loved how she was originally thinking of becoming a doctor. She faced a lot of resistance, and then she went to San Diego and she found out that the naturopathic path was more of her style, and she's here to share your story with you. Hi, Dr. Ashley.
Hi, so nice to be here
Yeah, so can you tell me a little bit about your story and how you decided to become a naturopathic doctor and why, and what type of women you're helping today?
today. Absolutely. So, to be completely bluntly honest, and being the New Yorker that I am, it's in my nature to be very honest. I never thought I would want to be a naturopathic doctor. I graduated high school a year early, always in the hopes and in the dream that I would become a doctor. And I started shadowing different doctors in every possible field that you can think of. Everything from pediatrics to, dermatology, anesthesiology. I saw so many different surgeries and procedures. And every time I was kind of going in, waiting for my heart to explode and have that aha moment that this is what I'm supposed to do. And it didn't happen. And I kept opening different doors and they would close strangely. And I was very confused. And when I moved from New York to San Diego, and those of you that have done that move or are from the East Coast, you know that the West Coast is a completely different world with a completely different level of consciousness and what they view health to be. So that kind of started my own personal journey. I completely started living a different lifestyle and changed my diet and started practicing mindfulness and all these different things. And along that path, I met a naturopathic doctor. And it was within the first few minutes of chatting with him and his philosophy of naturopathic medicine that I had that aha moment that I was searching for. And I knew that that's the path that I was supposed to be on. And a few of the key things that really stuck out to me was that naturopathic medicine is all about finding the root cause. So we don't really accept a diagnosis. I mean, a diagnosis is just a word, it's a group and a box that people are put in. But as a doctor, I like to think of naturopathic medicine as we're all detectives and we want to understand why this is happening because we're all unique individuals. We have all had different things happen to us and the outcome may look similar, but it really is completely different. So I love naturopathic medicine because it's individualized, it's root cause based. We start with the least invasive treatments first and then kind of work up that ladder because the underlying belief of naturopathic medicine is that the body has an innate ability to heal. It is an intelligent organism, and once you kind of remove the obstacles and layer in anything that you might need that you've been missing, the body reorganizes itself and the natural state of being is health. So with that being kind of the roots and the soil of this medicine, it's been so beautiful diving into it. I work a lot with kind of functional disorders, things that you would see a Western doctor for that they might be like, huh, is that in your head? So things like IBS and gut disorders, just bloating and gas, kind of these symptomatic things that a lot of us face, a lot of mental health, brain fog, anxiety, depression. I work a lot with women regarding hormones, as we're going to talk about today. I do a lot with thyroid and a lot with reproductive hormones because as women, our hormones are constantly fluctuating and that has so many downstream effects on the rest of our physiology. So I definitely have a passion for working with women, children, and the whole family and just bringing everyone to this space of allowing their body to heal.
That's amazing. And so when you work with hormones, I remember when I was healing my thyroid and like other hormones were going off, and I had estrogen dominance, and like I was dealing with like low testosterone, all these different things. And for a while there, I was like, oh, should I do like the bioidentical hormones, which most women typically do? But then I thought, like, your body's pretty smart. Like, I mean, of course, like, why would it just not produce these hormones? And then if you do that, like, and your body starts producing the hormones, then you have another imbalance. So what are your thoughts on that?
Yeah, great question. I always take any symptom as a sign that the body is telling me something. So you mentioned estrogen dominance, which is extremely common. And basically that just means that estrogen in relationship to progesterone is elevated. And that doesn't always mean that you have high estrogen. It might mean that you have normal estrogen and really low progesterone. So again, I kind of go in my detective mode and I say, why? A lot of things that I see in women, since we're chatting about women, but really most people on the planet today, is that we are significantly stressed. The body is incredibly intelligent in that if we are feeling significant stress, our adrenal glands go, okay, let's rise to this occasion. Let's try to soothe some of this stress, and it secretes cortisol. What that does is instead of the precursor hormone pregnenolone becoming progesterone, it becomes cortisol. And instead of pregnenolone becoming testosterone to give you libido and focus and muscle mass, it goes to cortisol to help soothe the stress. So for me, yes, I mean, and in your situation, you could have been putting on bioidentical hormones. You could have been given oral progesterone and testosterone, but would that have solved the problem? No, it would have just masked it and pushed it deeper. So for me, stress is a huge one. I mean, our adrenal glands are always managing our stress, and they make so many different steroid hormones, including reproductive hormones. They kind of run the show once the ovaries go offline. And I also work a lot on environmental exposures, because a lot of things in our environment, they look like estrogen and they act like estrogen in the body. So things like BPA in plastic, it actually looks exactly like estrogen and can act like that in the body. So giving you more estrogen or more progesterone wouldn't fix it. Removing the underlying cause would fix it.
Yeah, I remember my progesterone was pretty low. My estrogen was normal, and my progesterone being low was throwing off my thyroid and my adrenals as well. So, it's like a lot of women, they kind of look at Hashimoto's as like, oh, it's only a thyroid issue, but it's really your whole endocrine system. And I remember like I was on thyroid medication for a little bit and I saw it wasn't helping me, and it made sense because like when you add a hormone to hormones, it creates a deeper problem instead of just removing that stress and like cleaning up your lifestyle, which is hard to do because you're stuck in this mindset of like doing something and you're hoping it's going to work for you, and even when it's not working for you, you're not willing to change. So it's it takes a lot of courage to want to change your lifestyle. Yeah, especially for me, I was pretty athletic, and then when I had to fix all my hormones, like my coach said, hey, I need you to go from like working out 6 days to working out 2 days and 1 day of yoga. And I said, what? Like, it was just like, I'm like, are you tripping? Like, I was totally, I thought I was like, okay, well, I don't want to, look differently. I don't want to gain more weight. And he's like, no, just do it. Just try it. And it took a lot of courage, but I think it was the whole mindset, lifestyle change. And at the end of the day, you're right. Like he was just trying to remove that extra stress in the life that most people don't even look at. And all of these things, like I meet a lot of women that have brain fog, anxiety, depression, all of these things that are related to, they think it's related to Hashimoto's, but I found out, like these neurological issues were mostly related to stress more than Hashimoto's. Do you find the same sort of link there?
So I absolutely agree that stress is an underlying driver of so many imbalances. It completely messes up all of your hormones, which can lead to so many presentations of imbalance. However, I will say that Hashimoto's and kind of neurological health do go hand in hand. And I'm so excited to dive into all of that and to get super nerdy, because for some people, stress is that one thing. But for other people, the autoimmune reaction is that one thing. But then what is driving that? So it's still, that's just the tip of the iceberg, and you keep getting deeper and deeper. But thyroid hormone is actually It's the key to light up the entire system. So if we don't have enough thyroid hormone, the brain can't even turn on. And if the brain isn't awake and alive and resilient, that's when we experience things like brain fog. And of course, there can be so many other reasons why that can show up. But for a lot of the patients that I work with, the thyroid is what is causing these mental health imbalances.
Wow. So how does the thyroid, like, I mean, it's like the command center of the body, but how can you deal with all these neurological issues that you have with the thyroid?
Mm-hmm. So let's kind of dive into the physiology, and then we'll get into how to do that. It's not as easily answered because everyone's why is different. But really, you can't talk about the thyroid without talking about the brain. And it's because the thyroid, to even secrete its hormone, which then, goes in the blood, gets active, binds to every single cell on your body, for that dance to happen, a signal in the brain has to tell a deeper part of the brain to talk to the thyroid. So it's actually called the hypothalamic pituitary thyroid axis. So it starts in the hypothalamus, swims on down to the pituitary, and then it talks to the thyroid. And thyroid hormone in general is needed to make neurons connect. It's needed to make neurons grow. It's needed to myelinate neurons, which is basically the fatty sheath around each wire of your nerves. Think about it as literally wiring. It just helps those signals transmit more quickly and more strong. And it also helps to create new neural connections. So if we don't have adequate thyroid hormone for whatever hormone imbalance, or if there's ongoing autoimmunity, or if there's something else that isn't being addressed, all these processes can't really take place. So it's all about finding out where in that line something's getting caught, but also what else is going on physiologically to calm the inflammation, to soothe the autoimmunity, and to make sure that everything is doing its appropriate dance.
That makes so much sense. Yeah, I remember when my thyroid hormone was high, my LH was high, my aldosterone was high, and all these are made in the pituitary gland. And I'm like, what is going on in the pituitary gland that is off, that's causing all this ruckus, in the endocrine system? And I think like when you find out like, hey, it's something that's in your brain, like the pituitary gland or the hypothalamus that's causing this, how do you address that?
Yeah, so really, although these signals are kind of coming from up here, it's all based on the feedback from the thyroid. So usually the first place that I do focus is, okay, what's going on with the thyroid? So for instance, of course, this whole discussion is about Hashimoto's and thyroid imbalance. So Hashimoto's is an autoimmune disease. And I know that you've personally experienced this just from our brief discussion, but usually autoimmune diseases don't run by themselves. They usually have other markers that spill over. And one of the most common places for autoimmunity is actually the central nervous system. So some people who have autoimmunity, for instance, most people that have Hashimoto's, I find if I test them for celiac disease, a lot of times they have those autoimmune markers as well. This is also similar for different neurological antibodies that can either attack different parts of neurological cells, or that they can inhibit your ability to convert glutamate, which is an excitatory neurotransmitter, to GABA, which is a calming neurotransmitter. So then for these patients, if they have autoimmunity against that enzyme, they're not going to be able to self-soothe, and they're not going to be able to calm themselves down. So for that group of patients, my main focus is to decrease the overactivity of their immune system so that it's not targeting kind of everything along that path. However, for other patients, the reason why they're having these neurological concerns is because they're just inflamed in general. It's not necessarily autoimmune in nature. It's just their immune system's kind of going rampant. And that could be from environmental exposures, chronic infections, or something that I see all the time in my practice. It can be, stress. Stress makes us inflamed. And there are actually many studies that have shown that an inflammatory chemical called interleukin 6, it goes up when there's acute stress, when there's trauma, when there's inflammation. That interleukin can swim in the blood. It goes to the brain, and it creates symptoms of depression. And studies have also shown that kind of the levels of inflammation can predict the severity of depression. So on those patients, that's kind of the road I would take. And really, again, if the issue is at the thyroid, where the thyroid isn't able to make any hormone, that's what I have to focus on, why the thyroid can't make hormone. Because if it can't do that, it can't make new neurons, it can't make connections, it can't heal, it can't repair.
Mm-hmm. That's so true. And many people I see like have issues with, it starts in the brain, and then it's sort of like, even when you're feeling tired, I remember I did like wave therapy for a little bit on my brain. And I noticed that like I was so energized after that, despite the fact that I had Hashimoto's. And I was like, how is that possible? Because like, it's like electric waves, basically current, like going through your brain. And it all of a sudden you feel the energy, and it's like, but you think that your body is causing this sluggish, like fatigue that you're feeling, and it's really the brain.
Yeah.
So, oh yeah, go ahead.
No, I was just going to say that the brain, I mean, it's so important. And I see this all the time, just brain fog and not feeling right and not feeling like you're present. And it can be as simple as being like, where did I put my keys? I was just holding them. Where did I put them? I know I had them. And it just takes a little while for kind of those neurons, the message to go from one side of the brain to the other. And it's really because of just low activation in general.
So what's like your biggest tip for somebody that is like dealing with these sort of neurological issues, chronic fatigue and Hashimoto's, and just not knowing, what path to take?
I would say probably the first step for anyone having both thyroid imbalance and neurological imbalance is to know where your hormone levels are at, whether you're being medicated or not. Just because if your thyroid has been destroyed, because essentially that's what an autoimmune reaction is. You have antibodies that then target your own tissue. Those cells can then, for lack of a better word, explode and release thyroid hormone into your blood. And if that process goes on for a long time, you can destroy your entire thyroid. And I'm not sure if you've worked with women like that. Unfortunately, I have. And it's their body was screaming at them for so long. They didn't really listen for whatever reason. I think a lot of it is fear. Who knows? That then their thyroid isn't able to make enough hormone. And if their thyroid isn't able to make enough hormone, you will never, not never, but without hormonal assistance and without the tools that you need to repair, your brain won't be able to turn on. So step one is working with a practitioner that knows how to read thyroid labs and who doesn't just test TSH. Because I find that very, very often, but those of you that are listening and who have Hashimoto's know that TSH varies. It goes up and down because it's responsive to how much hormone you're making. But the reason why you're having low hormone isn't because of an issue with TSH, it's because of an autoimmune reaction. So having a doctor that is very comfortable with dealing with autoimmunity and who can tell you what your levels mean for what you need to do next, and kind of layered into that, once you have someone guiding you, I know that you've chatted a lot about this, and I'm sure a lot of your followers have really dove into the world of gut health, but I wanted to kind of layer in something else. Basically, if your gut is leaky, which is a term that a lot of people are familiar now, but just in case you're not, the gut lining is a single layer of cells, and they have different proteins to bind them together. And that's important because I don't know if you've ever thought about this, but the gut is the outside world. It's a tube of all the outside world, and it is a single layer of cells that decides what gets absorbed and what gets integrated into your own being. And if the gut is leaky from stress, first of all, stress will do it, toxins will do it, too much alcohol will do it. Lots of things will break down that gut barrier. And if the gut barrier is leaky, the brain barrier is leaky. And if the brain barrier is leaky, it's also a single layer of cells, then products from the blood that shouldn't go to the brain, because just imagine how tightly regulated the brain is. It is one of the most precious parts of our body. So things that should not be getting into the brain get in. So things like infections, food particles, inflammatory mediators. And that is why healing the gut is so powerful, because it drastically decreases inflammation on every level, because it's directly affecting what is being pulled into the blood and what is being seen by the brain. And if the brain is seeing something that's inflammatory, it kind of creates this war in a sense, because the brain has an immune system, but it's different than the systemic immune system that kind of sees something, swims around, targets it, and then goes to sleep. When the immune system of the brain gets active, it's very difficult to turn it off. Mm-hmm. So if you have a leaky blood-brain barrier and you're getting these different constituents into the brain that are then leading to an inflammatory reaction, something called microglia, which are the immune cells of the brain, they stay on and they start to clean up shop, but they're not, I mean, they're very intelligent, but they're not that regulated in the sense that they'll eat healthy tissue too. So that doesn't sound good, right? That kind of sounds like dementia, and that is dementia. So one of the best things you can do, get a provider that can guide you. And second, heal your gut. I cannot stress that enough. In healing your gut, you're going to help heal your brain and bring yourself back to your own self.
Yeah, a lot of people talk about healing the gut, and like the truth of the matter is everyone in the world has numerous infections, whether they have leaky gut or not. So how do you build resilience to this, so your gut is actually able to digest the foods you eat, is able to fight off these infections, and you're not trying to kill off things one by one, because, some doctors may say, oh, you have candida, you have, this infection and that infection and EBV. And the truth is, like, we all have these things, but it's like, is it really worth killing everything like one by one? Or it's like, why don't we build resilience to it?
That is a really great question. And I think that is kind of where a lot of practitioners and a lot of patients get caught up. I can't even tell you how many people come into my practice and they're like, I have candida. And I'm like, how do you know you have candida? And basically, I kind of see these imbalances in the gut, again, as a symptom. They're not the problem. You don't have kind of bacterial overgrowth in your gut, and that's leading to these other health outcomes. You're having bacterial overgrowth or fungal overgrowth or whatever it may be because your gut isn't functioning properly. And kind of the connecting piece to these two worlds is the vagus nerve. So the vagus nerve is cranial nerve 10. It is my favorite nerve in the body, if anyone ever asks you. And it's my favorite because it starts in the brainstem, it swims down and it hits the throat, it hits the lungs, and it hits all of your digestive organs to secrete digestive enzymes and to move things along. And you can actually do a little self-test on yourself. I wouldn't do it now because you'll find out why in a second, to find out if this nerve is working properly. And you can find out to see if you gag when you're brushing your teeth. If you put your toothbrush super far back, you should gag. You should absolutely gag. And that is a sign that this nerve is active. It's constricting the muscles in your pharynx, which is what is needed to push food down. That's optimal. I can't even tell you how many of my patients, I'll test their gag reflex and they don't have one. And what that tells me automatically is that their gut is offline. And if their gut is offline, it means that they can't digest, they can't absorb. If they're not digesting and absorbing their food, the bacteria that live within us are digesting and benefiting from our food. So that leads to things like bloating or diarrhea or constipation. And while I could throw every antimicrobial I have at these patients, whether it's natural or pharmaceutical at them, yeah, it will kill the infection, but it would just come right back. So one of my favorite pieces of resilience for the gut is vagal nerve exercises, which is as simple as activating this space. So right now we've both been activating our vagus nerve the whole time we've been chatting. Wow. But things like humming, singing, gargling. Truthfully, I tell my patients that I'm working on gut and kind of overall decreasing stress. I tell them when you brush your teeth, twice a day. Stimulate your gag reflex. When you're in the car, hum really loud. When you're in the shower, sing at the top of your lungs, and you'll feel yourself start to salivate. And that's a sign that you are telling your gut, okay, it's time to digest, it's time to absorb, and that also increases blood flow to the gut. And you can't heal your gut if there's no blood going to it.
Wow, that's so informative. I think nobody really knew about this gag test. It's because I don't know, like you kind of can tell like if you're having all these bloating, all those issues, and say that the vagus nerve, has a big part in that. But what if it's like more on, let's say, in the colon area where it's like the descending colon or like some people have SIBO, like is that really also controlled by the vagus nerve?
It is, and I'll tell you why. So the vagus nerve is responsible for the autonomic function of the gut. So moving things along, but also there's these different kind of portals in the gut that we call sphincters. And at certain times they should be open to let things pass along. And certain times they should be closed so that things don't pass along. And basically SIBO is when bacteria from the colon, which bacteria are supposed to be there. We need bacteria to function. They should be in the colon. But the sphincter in the right lower quadrant of the abdomen opens, and bacteria that were deep get to swim on up to the small intestine. And what's in the small intestine? All the delicious food that you just digested. So the bacteria have a party. They have all the food that they could ever want. They have free open space, so then they can just eat the food and take over. And that is directly related to the vagus nerve, because if the vagus nerve isn't active, then that sphincter will be open, and those bacteria can swim through.
Wow, that's so interesting. I don't think anyone, a lot of people just kind of look at infections, they look at bacteria, candida overgrowth, but the vagus nerve is probably the one that receives like the least respect because it's like I don't think people know that they have to do these things to even activate it. So have you worked with a lot of women who have Hashimoto's and they're coming to you and they say, Dr. Ashley, how do I lose weight with Hashimoto's?
Yes. And honestly, not most, but I would say a lot of the time, my patients that I then find out that they have Hashimoto's, they've already gone to their primary care doctor and they've said, I don't feel right. And then their doctor runs labs on them. They usually just run a TSH. Their TSH might be normal. And then they say, oh, it's not your thyroid. They come to me for weight loss. And one of my first questions is, okay, has your thyroid ever been tested? And they say, yes. And then I look at their previous testing and I see that only one value was run. So then I run their labs with their autoimmune markers, and a lot of the patients that initially came in for just this stubborn weight that can't be lost, it's because they have a very underactive thyroid. And a lot of the times it is Hashimoto's because, as we know, women are highly susceptible to autoimmune disease. So to help them lose weight, kind of to layer in all the things that we talked about so far, I focus a lot on the gut in that I want to make sure that they are digesting and absorbing their food. I work a lot on stress because if we're stressed, kind of another piece to that vagus nerve is that it's part of the autonomic nervous system. So I'm sure we've all heard of the sympathetic and parasympathetic. Sympathetic is when we feel stressed, when we feel intimidated. And evolutionarily, it was beautiful and protective because if we had a threat, it was significant and we would have to run away from it. And what that requires is that the blood goes to the muscles. So when we're in the sympathetic state, our blood shifts from everywhere else, from the brain, everywhere, and it goes to the muscles so that you can either run away or punch something in the face. And what that does, it turns the vagus nerve completely off. And I find that a lot of women that I work with, especially women that are not only mothers, but they're working full time or they're going to school or they're just, superheroes, that they live in that sympathetic state. So a huge part of their healing and in making sure that food is moving along is getting them calm and getting them into the parasympathetic, turning that vagus nerve on. And a lot of the women that I work with, the weight is there, and they say, I just don't have the energy to exercise. I just feel dense and heavy. And once we get the inflammation down, their thyroid comes back online, and it's kind of like all the pieces start to swim together at the same time. And also, to exercise and to move, we need motivation, which lives in the brain. And if the thyroid isn't online, we don't have enough thyroid to wake up the brain. And kind of once you fix that piece, then the motivation comes back, the weight starts to fall off, and they feel more like themselves.
Wow. And that's the thing is like, it's almost like when you remove that stress, the weight kind of falls off. And it's like stress even within your organs. And sometimes you don't even realize it, right? Um,
Absolutely.
and also, like when you work with women, have you ever seen like, women who have, say, Hashimoto's and like estrogen dominance and PCOS, and it's kind of like, all their hormones are all over the place. How do you address that? Like, do you work on Hashimoto's first? Do you work on their estrogen dominance or PCOS? Like, how do you go about it?
So I kind of love that you brought up PCOS in chatting about this, because I see a lot of women and a lot of them walk in with this label, I have PCOS. And I'll sit down with them and they think that they're kind of destined to have this hormone imbalance for the rest of their life. But what their doc didn't tell them is that PCOS is actually a metabolic disease. It is due to inflammation, it's due to insulin resistance. And insulin resistance basically happens when our blood sugar goes up and down and up and down and up and down. And when our blood sugar is high, our pancreas secretes insulin to open up the cells to let our cells soak up the sugar from the blood. And when our cells do not, or when they've heard that signal so many times, because there's only so many times they can hear the same message of there being super high blood sugar, that the cells are like, I'm not opening up. You're asking too much of me. And this blood sugar stays around in the blood, leading to a lot of inflammation. High insulin will change hormones because it's a hormone in and of itself. So it kind of just changes the physiological pattern. So I do definitely see that these kind of conditions go hand in hand, because if you're inflamed and your blood sugar is off, of course your hormones are going to be off. So really, I'm not trying to make it sound more simple than it is, but once I get my patients, once I get their stress down, once I get their cortisol down, once I get their blood sugar balanced and their gut healed and they're sleeping and they're practicing gratitude and they're exercising, the natural state of the body is health. Things kind of just fall into place. But I mean, for my patients that are really struggling with, maybe night workers, or they have an addiction to alcohol, or they have significant relationship stress, these things that are more difficult to move past, until they're ready to let go of what is truly that obstacle to cure, it's difficult without, those are the patients that request, can you just give me some bioidentical hormones? I'm like, I can, but we can fix this.
Yeah, that's so true. And I mean, do you ever use bioidentical hormones for like as like a crutch, or it's kind of like a no-no on your list?
I wouldn't say it's a full no-no. And I will say that a lot of naturopathic doctors, that's their bread and butter. They do a lot with hormones, and it's because it can be a game changer for people. I personally really like to stimulate the body's ability to do it itself. And also, I see a lot of women. I'm in Southern California. I mean, everyone's beautiful. Everyone wants to stay young. And when women are getting to perimenopause, they're like, can you put me on hormones? And I'm like, nah, girl, you're going through this transition of life. This is a shift of becoming a woman. And so those patients definitely would like hormones, but if physiologically you don't have them at the stage of life, I don't necessarily believe in them. And it's something that I would consider layering in after we've done all the work, after we've opened all the doors. And if the body wasn't able to produce something that is essential, like hormones, they are essential for different stages of our life, then I would consider it. But I definitely try a lot of other things first.
That's a good call. Yeah, I think with hormones, it's always a fine line, and you never want to have too much or too little. And and that's my sort of, I guess, like hesitancy behind the bioidentical hormones. Is like, hey, what if your body just decides to like start producing a lot more, and then you're also taking it also has this extra. So yeah, and you don't want to get dependent on it, and that's the other thing too. And so I love your methodology of just using the body and letting it naturally do its thing. And do you even recommend that for women who are dealing with perimenopause?
So most of the women that have significant symptoms around perimenopause, the hot flashes, night sweats, mood instability, things of that nature, it's because their estrogen is low. And estrogen is naturally going to decrease as we age because the ovaries are the main producer of estrogen. And when we're approaching that phase of life, the ovaries have done their work, they're starting to go offline, and that means that the adrenal glands have to take over, making sex hormones. And I find that most of the women that have the most severe peri and pre and menopausal symptoms are those whose adrenal glands have been completely overworked. It's in my patients that once their adrenals are completely nourished and supported, then they're able to kind of make an appropriate amount of estrogen for their age. So then they won't have those sexual side effects, those mood side effects. I'm so grateful that I have so many women in my practice that have transitioned so beautifully and with ease and are like, I never had a hot flash. Yeah. So it's really all about adrenal health. And in that phase of life, no, I wouldn't prescribe hormones because we're not necessarily supposed to have them at that point. But I would prescribe adrenal support.
Yeah. In terms of like case studies, can you give us like a couple of case studies on how you took someone that came into, saying they had Hashimoto's, weight issues, and turned their lives around?
Yes. So I have two. The first one I'm really excited to share with you because I think that it kind of brings a lot of these things together and it's really empowering. So this patient, it was actually when I was a student at Bastyr University, and my mentor taught me so much, and this was one of the most beautiful cases that I've experienced. And it was this young girl, she was 17, she was in high school, she was overweight, and she was an athlete, and she didn't understand why because she was working out all the time, but she was starting to get fatigued, and she ate a standard American diet, as most 17-year-olds do. And she didn't really have too much gut symptoms, or not at least that she wanted to talk to me about. But we ran her labs. Her TSH was through the roof. She had significant autoimmunity. Her TPO enzymes were in the 300s. So there was significant inflammation going on. And her mom was there, and this doctor that I worked with, her kind of treatment approach, she gave them two options. And this was honestly one of the first times I had even heard one of my supervisors give these two options, because some naturopaths are a little bit more allopathic in the way that they operate, and others are more vitalistic in the way that they operate. So it was really fun to see these two approaches. And on one hand, she said, okay, we can absolutely work on your inflammation, your autoimmunity, but you'll probably need thyroid hormone to give you that boost. Or we can decrease and balance your hormones out without putting you on anything. And mama did not want her to go on any hormone. So that was the route that we went. And to be completely honest, I had my doubts because her antibodies were very high and she was very uncomfortable. And this was something that I wanted to definitely share because I find it so interesting that all of these hormones that are in this hormonal cascade to talk to the thyroid, yes, they're talking to the thyroid, but they also have different actions that they're doing. And the body is so smart. That's one of the main takeaways I want everyone to have. The body is intelligent. It is having autoimmunity against itself for a reason. And in this case, and in a lot of Hashimoto's patients, the autoimmunity, the antibodies are produced against the thyroid as a way to protect itself. And let me explain that a little bit more. So TRH is released from the hypothalamus. It is also released with a busy mind. So in patients that are overthinking, that are kind of stuck on their story and going these repeats, your TRH is always going off. What that does is it tells your TSH to increase. TSH is what will eventually bind to the thyroid cells and have thyroid hormone be reproduced. But one of the main reasons why TSH is secreted is because it swims through the blood, goes to the pancreas, and tells the pancreas to make more digestive enzymes. So even tying the gut together once again, in these patients that have what we would call pancreatic insufficiency, there's something wrong with the pancreas, but for whatever reason, it's not able to make appropriate digestive enzymes. This could be because you're eating foods that are just difficult to digest, like gluten and dairy. They're just very hard to break down for many reasons. It could be due to just having inflammation in the gut. But regardless, this TSH being really elevated, not only is it screaming at your pancreas, but it's screaming at the thyroid to make more and more hormone. But then the body is intelligent and it says, we don't need that much thyroid hormone. That's not why TSH is loud. Let's make antibodies to calm this down. And in this patient's case, in the 17-year-old, that's exactly what happened. So all we did with her, not even kidding, is work on her gut. We had her 100% cut out gluten, 100% cut out dairy, do an anti-inflammatory diet. So for a 17-year-old, that means no soda, no processed food, no fast food. We had her work on her stress and start going to yoga with her mom. And we reran her labs in 3 months and she had no autoimmunity. Her TSH was within normal limits and she never needed to go on medication. And that was so powerful for me to see as a soon-to-be doctor, because it showed me, first of all, how resilient the body is, and also opened my eyes to how many people are medicated that probably don't need to be. And then it's a pill that they'll be taking for the rest of their lives when really the why was never answered.
You're so right. Yeah. What about your other case study?
Yeah. So I also have a patient in my current practice who initially came to me for weight loss. And she said she's tried everything. She exercises all the time. She eats pretty well. And I would say, just as a generalization, most people in California eat pretty well. I mean, as a New Yorker living in California, most people do pretty darn good for themselves here. So she was already doing a lot of the lifestyle things like drinking clean water, and she cleaned up all of her beauty products. And again, I asked, has anyone ever tested your thyroid? And she said, yes, my aunt is my gynecologist. She runs my labs for me and she runs my TSH. My TSH is always high, so I've been taking thyroid meds. And I said, were you ever tested for Hashimoto's? She said, no. So we ran her labs. I have never seen antibodies this high. They were in the 600s. And that is telling me that there is significant autoimmunity against the thyroid gland. So with her, she was quite uncomfortable in her body just because she had never held on to that much weight before, and it was unfamiliar to her. She didn't understand why it was happening. And there's always something driving autoimmunity. So in her case, her thyroid could make some thyroid hormone, but she just had ongoing inflammation that was kind of interrupting the process. And also inflammation can inactivate thyroid hormone. It can make it so it can't turn into active T3, which is responsible for boosting your metabolism. So anyway, with her, we did all the lifestyle things. We did some nutritional things because the thyroid actually needs a lot of very specific nutrients to do its job. And she was quite vitamin D deficient and vitamin A deficient. So I wanted to correct those first, but then still something wasn't right. So we ended up actually running a food allergy panel on her because different foods can impact your immune system. And if a food gets through the lining of the gut, your body can create antibodies against it. And a lot of the antibodies to food look similar to our own tissue. It's called molecular mimicry. On this patient, we ran her food allergy test. She was allergic to a handful of things, but significantly so. And most of them were things that she was eating regularly, things that were healthy. So the test that I usually run is through Cyrex Laboratories. It's Array 10. It is phenomenal. The immunologist that developed this test, he was actually the first to create a food allergy test. And it's my favorite because they test both raw and cooked foods, because a lot of food allergy tests, they're only on raw foods, and we don't eat, I mean, maybe some people eat raw eggs, but we don't really have raw chicken, all these other things that don't fully make sense to test. But this test is extremely comprehensive, and what came up for her was chicken, avocado, and I think a fruit that she would eat all the time. So basically, she cut those foods out. I actually saw her yesterday, and I couldn't even believe what she looked like. it's like the weight just fell off. And she's also a yoga student of mine, so I know how active she is. I know how much work she puts in. And it was incredible just to see for her cutting out those few foods that were consistent inflammatory activators for her was what she needed for her thyroid to come into balance and for her metabolism to come back online.
Wow, that's incredible. I've never taken the Cyrex Array 10. I've taken the pathogen one, and that was really informative. I think it was Array 12.
Mm-hmm.
I should try out the Array 10, see if it's informative. It's through a blood test. I see. Yeah, I've done like the prick. A lot of women do like the ones that you have to do like pricks in the back of your body, and then others have done like the one where it's kind of like the Zyto sort of scan where you put like your hand and it tests like what you're allergic to. But I should try that out. It's always informative to understand what you're allergic to and what could be causing this ruckus in your body and how you can fix it. And a lot of people think, oh, it's quinoa, it's brown rice, it's like all these healthy things that really could be unhealthy.
Yeah, absolutely.
So that's amazing. And I think, just to end this call, because I think we're going way over time, can you tell us what your 3 biggest takeaways are today, and also how you help your clients ensure that they get results?
Absolutely. So my 3 biggest takeaways, the first would be that the vagus nerve is your best friend. If your vagus nerve is not online, you will not have gut health. And something that I didn't even get into that I won't fully open that can of worms is that the vagus nerve helps to regulate your immune system. And of course, when we're talking about hormone health and Hashimoto's and autoimmunity, having a balanced immune system is key. So vagal nerve exercises can be one of the best things that you can do for your gut health, your mental health. The second will be that depression, dementia, all these things can be associated with low thyroid hormones. So you want to make sure that you're doing everything in your power to have adequate thyroid hormone levels. And the third is that you all have a why. You did not get here for the same reason. You have a unique story. You've had unique traumas. You've had unique experiences and exposures. And you need to find a provider that can help you find out your why, because once you find your why, you will heal. Your body wants to heal. And to kind of roll into that next question, that's how I ensure that my patients get better, is because I want to find out why just as badly as you want to find out why. And I won't keep digging until I find out why. I love running lab tests. I love opening doors. I love talking about all the things that you wish you could talk to your doctor about that maybe you're hesitant to, like traumas and our dreams and our aspirations. And I find that when I open a door that hasn't been opened before, oftentimes that's what's hiding behind it. So I keep digging. And that's the beautiful part of naturopathic medicine, is that the root cause is always addressed.
I love that. Thank you so much, Dr. Ashley. And I will make sure that your information is, in the link below so they can come to your site, check you out on Instagram, check out all the amazing insight you have. And thank you so much for being here today.
You're so welcome. Thank you so much. I am so happy to have connected with you. I hope that your listeners learn a few good golden nuggets, and I look forward to chatting more in the future.
Great.